My name is Dr. Jeffrey DeSarbo. I am a board-certified psychiatrist, and I specialize in the treatment of eating disorders. In my private practice, about 70% of my patients do have eating disorders, and I always average on about 400 active patients. So I have a very strong base of eating disorder patients that come to me at all different levels of treatment. Some may be just on the initial onset of their eating disorder, and some may be in the middle of their treatment, and some may be stalled or it's acute. That's where Avalon Hills comes in. I have to refer people to higher level of cares. And I've known Avalon Hills and staff here for over a dozen years. And it's been great because they create such an incredible environment for patient care, and they have both the empathy towards their patients, but they have a great fundamental basis of knowledge to speak the eating disorder language. They are specialists. And it's really important in the treatment of an eating disorder that people always be working with well-trained specialists. And that's what you have here at Avalon Hills. I got to appreciate that they were developing more and more of an interest in the biological aspects and the neuroscience. And I like how they've incorporated that into their entire treatment program and approach right now. They use things like EEG, not just for research, but to actually incorporate into treatment process so patients can see what they're doing, how that's affecting changes in their brain. And it's been something that I think has helped a lot of patients when they left here and come back to outpatient practice. Recovery is about that mental health aspect of helping them kind of get control of where their thoughts are and not just primarily focused all the time on certain aspects of eating and behaviors. Residential treatment is really important when a person gets stuck on their process towards recovery. Everybody often reaches this pain threshold where to do the next step to get through it, they kind of become psychologically paralyzed by the fear that goes with it. So coming to a residential facility really helps the individual be in an environment where they feel understood. The treatment process is difficult. It's psychologically painful for them to be trying to get themselves into a better place by being compliant with the treatment, what's required with them. But a residential facility gives them support. They're with others that feel they understand that what they're going through, how they're dealing with things. And this is, again, a process many people don't understand. I learned a great way of thinking of it from a patient that I had once who was telling me she was restricting, and her father said to her, "Why don't you just eat?" And she said, "That's like telling a person who's drowning, why don't you just swim?" It's something the person, even with their most sincere interest, wants to do, they can't do it on their own. Avalon Hills has been a treatment center that I've referred patients to for quite a while. One of the things that makes them unique is that they do take a more proactive approach in the neuroscience and neurobiology side of eating disorders, in addition to having a very strong foundation in the therapeutic and medical aspects of eating disorders. So their treatment really helps incorporate the holistic type of approach, the way I see it, as psychology, medicine, but also biology.